My name is Corrina McElduff and I am Director of Professional Affairs at Ocumetra. And Ocumetra, we are a data analytics company that offer a complete myopia management solution to eye care professionals in practice to really support that communication with parents to help them make informed choices and informed decisions. At the moment, we have a whole host of treatment options available for kids, which is great, and they're solutions that we are really familiar with. But still trying to get that message across to parents and make that message land is often quite difficult in day-to-day practice. So My Guide, which is one of our main tools at the moment on our platform, offers that complete conversation tool. So it allows you to streamline your myopia management conversation, but it also allows you an evidence base that sits behind it to support that informed choice for parents, but in ways that make sense to them, because a lot of this information can be quite technical, it can be quite medical. We do our best to break it down, but often still parents come away feeling a little bit maybe overwhelmed, not quite understanding something. So this gives them everything they need to know about their child specifically, and in a format that they can take away that's individual to their child. So what we're doing here is we're creating a personalised risk report for this child. One of the newest additions that we've added is our axial length analysis. Okay, so if we are a practice that have access to a biometer, we can enter measured axial length. If we don't, which is still the vast majority of practices, we can actually input information in here, so they're K readings, so that we can give an estimated axial length. And it's really important to note, our axial length estimator is matched for age and sex, and it gives a 95% prediction range. And this report is going to be pulled across over 1 million data points, okay? And it's going to, the very first thing will be this QR code will pop up, okay? So this is where a clinician in practice would ask the parent to scan that QR code, and that way they're leaving with their child's personalised reports on their phone. And at the moment, what we're seeing is that the vast majority of parents and children are still leaving without maybe undertaking a myopia management treatment option when it's been recommended to them. So that message still isn't landing, and that's what's so great about this, and this is what we really want to communicate and shout from the rooftops for people, that actually this is designed to help your message land. It's designed to really sort of streamline your conversations. It gives you everything you could possibly need when you're having a conversation with a parent. So any question that they are asking, any challenge that you need to overcome, all the answers are in this report. So we're broken down into 6 sections here. So first one, well, how does Alice's myopia compare? So this is where we have our centile, okay? So we're given that visual information. We're comparing where Alice is in comparison to other children of her age and sex. But it's also really important to note that we assume parents understand centiles, and they may in relation to their child's height and weight, but not necessarily in relation to their eyes. 98 centiles, so what? What does that actually mean? Well, that means it's much higher than average for Alice's age, and only 2% of children are more myopic than Alice, okay? The question a parent will next ask is, well, if they're this short-sighted now, where are they going to be? So we can give her a very conservative estimate of her predicted adult myopia level. So in this case for Alice, we're predicting her to be a minus 6.25 by the time she's 20. And then our next tab is our vision simulator. This is one of the most powerful aspects of our tool. We can show parents how she sees now with and without her glasses, but actually this is how she may see as an adult as minus 6. Minus 6, that number means absolutely nothing. This is giving meaning to what that number actually is. And then we have, well, how could myopia management help Alice? This is where we break down our short and our long-term barriers. So we can break that down, what that looks like, but also give an optometrist or a DO or CLO how much myopia we could save. Because again, that's another question a parent is going to ask. Well, where is she now? Where could she be if we give her a myopia management treatment option? And our next section, which is axial length analysis. This is only for a clinician. It might add an additional layer of complexity to that conversation. So clinicians can give the information if they wish to, but they don't need to lead with it. So we can teach people, well, actually, that measurement of 24, what does that mean again? And I refer to this all the time, that so what moment. So 24, well, actually, that's over a millimetre longer than expected for this child. But we'll teach people what's normal. What should a 7-year-old girl be in terms of her axial length? And again, where is she projected to be? Because again, we're seeing more and more refraction and axial length be displayed as centiles because it is familiar with their parents. But again, breaking down what that centile actually means for that individual. Now we can also calculate for them what percentage, how less likely is she to experience vision impairment if we begin treatment. So 63.8%. Okay. And we can also give clinicians treatment targets because we know that her axial length is going to change. She's going to grow, but what's normal versus myopic growth? The feedback that we always receive from eye care professionals in practice is, I don't feel very confident. And I can't sometimes get that message across, and I can't make that message land. And this is what we're trying to shift that dial towards. So that we're actually just helping that communication, helping structure it so that it becomes as routine as explaining cataract. We will list all the current available treatment options. Parents can click on this, they can find out a little bit more about each treatment option. They can also find out, is this an option for my child? So it gets them involved in that conversation as well to make that decision. But ultimately, it'll always be the eye care professional, it'll always be you that will decide which is the best treatment option for that child. And then our last section, well, what else can we do? So there's so much information sometimes to give parents during this very small appointment window and that free time that you have to discuss this. But again, parents can click on this, find out what it means. What do they need to start doing to really maximize their child's treatment, but also maybe possibly delay any onset of myopia in the first place. And it's all designed to be shareable. So for eye care professionals, they can click on this link and then they can paste it into their child's electronic health record. That way it's safely stored within that child's record and you can always go back and refer to it. You can share with parents via QR code, they can text it, they can also WhatsApp it to another parent or another caregiver because there's only ever one of them in the room and there's always someone else you want to have a conversation with. So this allows that consistency of messaging as well, because otherwise verbally given and non-specifically given, so in terms of just handing out leaflets, we're expecting whoever was in that consulting room to relay the correct information to someone else at home, and we know that doesn't happen. Information goes in one ear, it gets turned into something slightly different, and then comes out as something totally different again. So we're ensuring that consistency of messaging every single time. And for our very curious parents, as we like to call them, we have this link here, the science behind this report. So parents can click on that should they really wish to have some lovely bedtime reading about the clinical studies, about the clinical papers that sit behind both our tools, but also myopia management in general. So it's giving clinicians everything they could possibly need to structure their conversation, because they don't have to go through every single section. You'll normally pick out one or two that'll help the message land, but they're leaving with everything there, and they're not leaving it with a leaflet that'll get shoved to the bottom of a school bag or a shopping bag somewhere. It's on their phone, and they can always revisit it, and they can always access it once they have that link there. What we're hearing from our community is that it's helping the commercial success of their myopia management clinics as well, which is also really important to remember. We're giving our patients the best care we can possibly give them, but also by getting more of our patients onto myopia management, we're helping the financial success of our business too. So we've been building this for over 10 years, and we have been accumulating data over that period of time. We have epidemiological data, we also have longitudinal data within our data set, and the reason why that's so important is because if you include just data from myopia control studies, they're not actually truly representative of the population. They are typically fast progressors. They're typically all myopes. So we need non-myopic, but we also need myopic people within that data set. And we also need a range of ethnicities as well. So it means that we're truly representing the multicultural nature that we all actually work in now within clinical practice.